thickness, normal distribution. Hair is a lovely brown color. Oh my goodness, it's so thick. All right. I'm going to take a look at your scalp now. That's okay, Amanda? All right. I don't see any signs of dryness. I don't see any signs of lesions or masses. Take a look at the sculpt here. Your skull. All right. Your skull is a normative phallic shape. There's no masses, no lumps, nothing like that here at all that I can detect. All right. Scalp moves easily, and again, there's no lesions, no infestations, yay. No dryness that I can detect. All right, perfect, wonderful, thanks so much. Okay, so now I'm just going to be taking a look at your face, Amanda, which is lovely. Okay, face is normal, symmetrically shaped. Eyes are symmetrically shaped. Nose is midline, mouth is midline. Okay, perfect. No masses, no edema, no lumps, nothing like that. All right, perfect. Eyebrows are symmetric. Hair distribution is normal. There's no cracking. There's no caking, no lesions there. Can I have you close your eyes, Amanda? Yeah, perfect. Just open. No signs of ptosis. Eyelids are symmetrical. Lashes are curled up. Lovely. Very nice. The nose is midline. There's no masses, no lesions. No discharge, no exotasis, nothing there that I can see. I'm going to use my pen light. Go ahead and take these off, actually. Next. Okay. And we'll do some hand hygiene here since I've taken those off. All right, so what I'm going to do next, Amanda, if it's okay with you, is I'm just going to take my pen light here and make sure that's nice and clean. And I'm just going to take a quick peek up your nose. I know that sounds gross, but just to make sure everything's fine. If you don't mind, can you look up just a little, please? Perfect. No polyps, no lesions, no signs of deviated septum, and no exotasis. Perfect. All right. Have you look up just a little bit? Okay. Her lips are lovely. There's no lesions, no masses, no sores. Everything looks very good there. All right. Perfect. All right. What I'm going to do now, Amanda, is I'm going to take a little bit of a closer look at your eyes, if that's all right. I'm going to take my my fingers here. I'm just going to pull down gently on your eyelids just to take a look at your conjunctiva and make sure that's okay. 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 Conjunctiva is pink. Everything looks normal there. All right. Fantastic. I just lost my train of thought. Okay. So what I'd like to do now is I'd like to take a look at your eyes and see how they react to light, okay? So just looking at her pupils right now, got a medium lit right here. Her pupil size, wow, big pupils. Pupils are about 5 to 6 millimeters. Okay, wonderful. What I'm going to have you do is I'm going to have you just stare over here at this back wall behind my shoulder, okay? And I'm just going to be checking to see how your pupils react to light. They're round, they're equal in size and symmetric. Oh yeah. Direct and consensual pupil constriction on the left. And just let yourself stare out again. Direct and consensual pupil constriction on the right as well. Perfect, okay. What I'm going to have you do now, Amanda, is once again just kind of stare out, just let your gaze go out back here. And when I ask you to, I'm just going to ask you to stare here at my pen light. Okay, so just stare out there, just your eyes. Okay, go ahead and take your eyes onto the pen light, please, and just follow it. Wonderful, thank you. We have constriction of the pupils and we have convergence of the eyes. Wonderful, outstanding. Okay, if I could have you move your hair back just a little bit, I'm just going to take a quick look at your ears. Actually, before I take a look at your ears, I'd like to take a palpation here of your sinuses, if that's okay. All right. So right here, do you have any pain or tenderness here, Amanda?
Nope.
In your frontal sinuses, no? Maxillary sinuses, any pain or tenderness, Amanda?
Nope.
All right, perfect. Now I'm going to take a look at your ears. There's no lesions, no masses, no sores, no discharge, no serum present that I can see. Looking over here, no lesions, no sores. I'm going to palpate your ears, no serum, no discharge on the sides. I'm going to just take a quick, just tell me if you feel any pain or tenderness, Amanda, in the auricle here. Any pain or tenderness? No. All right, left ear seems fine. Go over to the right, same thing. Going to palpate your auricle here. Any pain or tenderness? No. Any pain or tenderness here? No. All right, fantastic. All right, what I'd like to do now, Amanda, is I'm going to take a look at your mouth. So we're going to pretend like we're little and we're going to go ah for the dentist. So if I could just have you open your mouth wide, please. Lift up just a little from here. Okay. Oral mucosa is pink and moist. No signs of masses. Dentition is in good condition. I see absolutely no missing teeth, no cavities. Everything looks nice and white and pretty. Hey, if I could have you stick your tongue all the way out, please, Amanda. Tongue is pink and moist with no signs of lumps or lesions or massive. So you get again, say ah, perfect. Thank you. The back throat is pink. Uvule rises. Tonsils are not noticeable, so everything looks fantastic there. Wonderful. Okay. So now what I'm going to do is I'm going to check your lymph nodes. Okay. I'm just going to be palpating to see if I can feel them. I should be able to feel them, but if you feel any tenderness or if you feel anything that makes you uncomfortable, please let me know. One more thing before I do that. I am going to palpate your temporomandibular joint just to make sure, see how that's going. I'm going to have you open and close your mouth, please, Amanda. One more time, please. All right. There's no cracking, there's no popping, no crackness. Everything seems to be doing well there. All right, so now what I'm going to do is I'm going to go ahead and check your lymph nodes, okay? I'm going to start here in the front with the pre-auricular lymph nodes. Please let me know if you feel any tenderness or pain. No lumps detected here. Post-auricular lymph nodes.
No pain.
Okay. Occipital lymph nodes. No pain or tenderness?
No.
Okay, moving down. Post-cervical lymph nodes. Any pain or tenderness?
No.
Anterior lymph nodes. Anterior cervical lymph nodes. Any pain or tenderness?
No.
Okay. Submental lymph nodes. Anything there?
Nope.
Submental lymph nodes, no pain or anything? Okay, second thing, can we go right here? Supraclavicular lymph nodes. Any pain or tenderness? Okay, fantastic. Okay, so the only thing we have left to do is I'm going to be taking a look at the front of your neck. If I could just have you lift up your neck for me, please. Down just a little bit, I'm sorry, not quite that far. All right, the trachea, my lighting is bad. Trachea is midline, okay. Can I have you swallow for me real quick? All right, perfect, structures are midline. What I'm going to do now, Amanda, is I'm going to be stepping behind you. I'm going to be palpating both your trachea and your thyroid. Is that okay?
Yeah, that's
all right, perfect. Be coming behind you here. Okay. Trachea is midline. Okay, if I could have you swallow one more time for me, please, Amanda. All right. Thyroid is right there, moving up normally as it should. Feel no masses, no lesions, nothing like that. All right, left you, please.
I need you to do that. Okay, go ahead and match my resistance. Okay. I need you to do that. Okay, match my resistance. We're just going to go that way. Okay. I'm just going to move it that way. Okay. Okay. Can I get you to stand up? We're going to move you on this side. Okay, can I get you to do that? Okay. Match my resistance. Can I get you to do that? Match my resistance. Can I get you to lay prone?
Yes.
Okay. Can I get you to do that? Okay. Go ahead and resist me. Can I get you to do that? Go ahead and resist me. Can I get you to do that? Okay, resist me. Hold, hold, hold. Relax. Need to do that. Okay, hold, hold, hold. Relax. Okay, can I get you to do that? Okay, resist me. Should do that. Okay, match my resistance. Resistance. Relax. And you do that. Okay, hold, hold, hold. Relax. And you do that. Okay, match my resistance. Hold, relax. Going to do that. Hold, 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 relax. Can I get you to do all those motions? Okay, go ahead and resist me. Hold, 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 relax. Hold, 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 relax. Hold, 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 relax. Did you do that? Resist me. Hold, 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 relax. Go ahead and resist me. Hold, 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 relax. Hold, 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 relax. Do those motions for me. Hold, hold, relax. Hold, 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 relax. Hold, 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 relax. Can you do that for me? Okay, that's my resistance. Can you do that? Match my resistance. Okay, I'm gonna try to do that. Match my resistance. Hold, 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 relax.
To your hair and your skull. Hair, looking at the distribution, looking at the color, making sure there's no lesions within the hair, that it's not excessively oily, that the skull is symmetrical, and there's no infestations. So that all looks good. Next, moving to your facial features. Looking at your face, I am making sure that your ears and your eyes are symmetrical, that your nose is midline, and so is your mouth. And then I'm going to take a closer look at your nose. I am going to make sure there's no visual lesions on the outside. I'm going to take a look inside. Once again, looking for any lesions, abnormalities within the nasal cavities. I'm going to have you close one of your nostrils and breathe in. Good. And then do the same with the other. Good. Checking nasal patency, ensuring that you can breathe out of both. And then I'll do your sinuses. So your maxillary sinuses, your frontal sinuses. Any pain there at all? Any tenderness? No? Okay. So those look good. Moving on to your mouth, inspecting the outside, making sure that it is midline. The exterior lips are pink or red. And then I'll have you pull down your bottom lip. Looks good. So your bottom lip, the inside of it is going to be moist, is going to be pink in color. Also taking a look at your gums, making sure they're not red and inflamed. That would be a sign of gingivitis. So those look all good, no irritation at all. Can you smile at me? Looking at your teeth are white. There is no missing teeth anywhere. They all look sturdy and healthy. Can you open your mouth, stick your tongue out, and then lift your tongue up and from side to side? Good. So the top of your tongue is rough, like it should be. The bottom, the attachment point is nice and sturdy and pink. Looks like there's no signs of irritation or fungus anywhere. Can I have you open your mouth, stick your tongue out at me? Looking at the tonsils and the oral pharynx. Those look good. They look intact. And no sign of irritation there whatsoever again. So next, moving on to your skin, assessing the color of your skin, that it is uniform to throughout and it is normal color to your race. Looking at the skin turgor, making sure that it falls back, which it does. Your nails for capillary reflex, or capillary refill, I mean. Making sure that your nail beds come back to normal color within a reasonable amount of time, that your nails are convex, and that they're pink in color. I'm also going to take a look, I'm going to assess for edema, looking at your lower extremities, since that is where it's most common. And if there were edema present, I'd have to rate it on a scale from 1 to 4. So +1 would be 2 millimeters, it would sink in. +2, it would sink in 4 millimeters. +3, 6 millimeters. And +4, 8 millimeters. So I do not see any edema present. I'm also going to take a look at your veins, making sure that there's no inflammation of your veins anywhere in your body. So those look good. All right. And then for musculoskeletal, we're just going to go right into that. I'm going to feel your joints, making sure there's no pain, no temperature changes, nothing, no abnormalities, that they all seem intact, so they look good. So now I'm going to assess your muscles. So I'm going to apply some resistance. So we're going to start with your sternocleidomastoid. So can you turn your head towards resistance and that way too? Good. Have you shrug your shoulders, your trapezius. Good. Arms out, deltoid. Good. And then you can put your arms back in. Show me your muscles. For your bicep and tricep. I'll do it on this side too. Bicep, tricep. Good. Let me see your hands. For your wrists. Good. Hands spread out. Don't let me close them. Good. Grip strength. Good. All right. And then adduction. Abduction. Good. Hamstrings. Quadriceps. Those seem good. And then ankles for dorsiflexion and plantar flexion. So your muscles all seem strong, intact. No signs of any pain anywhere. I'd also, with your skin, I would also note skin lesions. So like here's a papule, moles, which are normal for this patient, but I would also make sure to keep an eye on them to make sure they don't grow or become an abnormal shape. So, moving on to your eyes. Do you have a history of an eye astigmatism?
Yes.
All right, so I would notify that in my findings. And I would also make sure that I check that with her records. Have you ever had any blurry vision?
No.
And do you wear contacts?
No.
Or glasses? Good. All right. So I'm just going to assess the outside. I am inspecting the outside of your eye, making sure that your eyelashes are equally distributed. Can you close your eyes? Looking for any lid lag, any irritation with the ducts, which they look normal, so that looks good. Your sclera is nice and pearly white, and then I'll have you pull down. Good. And your conjunctiva is pink. There's no signs of irritation or redness. Well, that looks good. I'm going to test your, I'm just going to assess your pupil reaction. So I'll have you look straight at my nose. I'm going to flash a light in. I'm just making sure that your pupils constrict. Good. Good. And I'm going to look at the opposite one. Good. One more time. Good. All right. So those look good. They constrict and dilate together and at a normal rate. Next, we are going to, I'm going to test your peripheral vision. So I'll have you close or put a hand over one of your eyes and let me know when you see my finger, okay? Yeah. Okay. Yeah. Yeah. Okay. And switch eyes. Yep. 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 Yeah. All right. So peripheral vision looks good, normal, which is great. There seems to be no, nothing abnormal going on. So next we're going to do pupil accommodation. So I'm going to have you look closely at my finger, and when I drop my finger, I'm going to have you look straight ahead, okay? Good. So it's just making sure that her eyes constrict when they're looking closer and dilate to let more light in when they're looking farther away. And then finally, our last test, I'm going to have you follow my finger with just your pupils, okay? Looks good.
I have an eyelash.
So her 6 cardinal directions are good. There was no shaking with her eyeballs, and they both followed my finger equally. So that's good. Moving on to your ears. Do you have a history of tubes in your ears?
No.
How about a history of ear infections?
No.
Any pain?
No.
Okay. So I'm just inspecting them from the outside, making sure that they are symmetrical. Inspecting the external ear. I'm going to fold the pinna, push on the tragus, the mastoid process. Any pain there at all? No. Next, okay. I'm going to do a hearing test on you. Just going to make sure that you can hear. When you hear, or let me know what ear you hear my fingers rubbing at, okay?
Right. Left. Right.
Left. All right. Good. So your gross hearing is great. Oh, shoot. Backing up to the eye exam, I forgot to like assess your near vision by reading. So I'll have you read
generic name.
Perfect. That was my bad. So all right, so then your ear assessment is done. Moving on to your neurological. So your neurological, I'm going to start by assessing your level of orientation and consciousness. So you told me your name. Do you know what the date is today?
October 6th.
Okay. Where are we?
Your house.
And how'd you get here?
I drove.
Okay, perfect. So she's very oriented to herself, time, place, and how she got here. Next, we're going to assess memory. So I'm going to do short-term memory. So I'm going to give you 3 numbers, and I'll have you repeat them back to me. 3, 5, 7.
3, 5, 7.
And can you repeat them backwards?
7, 5, 3.
Perfect. So that's good. She also told me her recent memory, how she got here, and then her relevant memory, she said at the beginning of the assessment with her birthday. So now we're going to go into assessing the cranial nerves. So I'm first going to have you close your eyes. We're going to assess your olfactory. So I'm just going to have you tell me what you smell.
Alcohol.
Perfect. So your olfactory is good. Your optic, we tested with the vision.